muted. Leah, you're muted.
Okay, I don't know how long I was muted for, but we will start that over again.
All right.
Welcome, everyone, to our Thursday night patching podcast testimonial and stories. Tonight, we are so excited you've joined us. We've got two incredible testimonies to share with you tonight. My name is Leah Stasney. I am a Senior Presidential Director with LifeWave. I've been doing this for over 3.5 years, and I'm more excited about it today than I was back then. So today is December 12th. I've got my beautiful co-host with me, Dr. Jennifer Smith. Welcome, Dr. Jennifer.
Hi there. Thank you so much. Good to see you.
So excited everyone's here. All right, you guys, we're going to get started and jump right in so we can maximize the next 28 minutes with you and make sure that we share everything that you need to know about a life-changing technology. So first off, I just want to let you guys know that we are not doctors. Even though Dr. Jennifer is a doctor, she's not your doctor. We are not here to treat, cure, diagnose anything that you have going on, but we do want you to consult with your physician or your practitioner. The information we are sharing tonight is personal testimonies, and it's for that use only. If you're pregnant or nursing, of course, we want you to, again, consult your physician. So with that, Dr. Jennifer, I'm going to throw it over to you, and you can interview these two incredible ladies.
Okay, sounds great. Thank you so much. Melinda, I'd like to start with you. Would you mind unmuting? And I met Melinda here in Greenville, South Carolina, gosh, about a little over a year ago, almost a year and a half ago. And Melinda, would you mind telling us? I'd love to hear. It's been a while since I've talked to you about it, so I'd love to hear how you're doing and tell us how your life was prior to being introduced to the patches and what it's been like since. Let's see, let's make sure you're unmuted. Okay, are you able to unmute?
Yes.
Great, thank you. Hi there.
Yes,
Welcome.
thank you. Hi. Yes, thank you for allowing me the opportunity to share. I started wearing the patches a year and a half ago. I was introduced by a dear friend of mine who knew I was having back pain due to disc issues, and also a bone-on-bone knee. So when I started wearing the patches, I started with the X39 and the Ice Wave. I will say it's been a life-changing experience for me. That's why I'm continuing to wear them, and I'm a year and a half in again. When I first started with, like I said, it was a bone-on-bone knee, and I probably would have already had to have had knee replacement surgery had it not been for the patches. And I may still have to have the knee replacement, because they say when it's structural or something like that and it's gone for so long, oftentimes you will have to have that. But I can say I have little to no pain in my knee, and inflammation is very little, which is very unusual for a bone-on-bone knee.
Yeah.
And then so I've been, and the way I wear them, and there is, and Jennifer, you may have that where we can share that with those who are interested in the bone-on-bone knee, as far as the protocol for that, with the glutathione on the outside, the Aeon on the inside, and the Carnosine at the top of the knee. That is what I have been wearing. And it's helped me greatly. It's done an amazing job. Also, I wear the X39 on my back because that's where I had my pain. Actually, I wore two X39s when I started with the back, when I started wearing the patches. Now I'm down to one, and I've been doing that for over 6 months now, and I have little to no pain on my back. And I can tell, I feel like that is actually helping I know we can't say heal, but I'm at a place with my back that I felt like that was I could never be.
Wow.
And
How long did you have that back pain prior to patching?
prior to patching, I had my knee replacement in June, my left knee replacement in June of 20. So I would say 4 years. It
Okay.
started, after that.
The back pain started after the knee replacement
Mhm,
surgery?
mhm,
Okay.
mhm, mhm. So it was 4 years, and I'd had injections in my back
Oh boy.
to help. Yeah, and that lasted for maybe a year and a half, and then when it came back intense.
With a vengeance.
Mhm,
Okay. How
mhm.
often did you get the injections in your back for the
I
pain?
just had them the one. No, I had it twice. I had injections twice.
Okay. Wow.
The first time was the year and a half. Then the second one I had um lasted about a month.
Oh,
So that's why my girlfriend introduced me. She knew my back pain, and then that was the first place she put on was the ice wave was on my back.
okay, great. So she
Mhm.
placed Ice Wave on your back, and then you were using X39 as well at the time. All
Yes,
right. What did you think when you first started using them? Did you think this is crazy? Did
yes.
you
I had immediate relief.
Wow.
I won't say it was immediate zero pain.
Mm-hmm.
It was immediate relief. And the one thing I want to say is be be patient. As it comes and goes, as far as the waves of pain, and you'll
Mm-hmm.
think, well, what? And then you just be consistent and be patient. And I can tell you, it's done amazing things in different ways, just so many different things. I mean, I've just even progesterone. I was taking progesterone and estrogen. I'm talking about a lot of patches here. So if I go,
Yeah,
y'all
that's all right. Go
reel me
ahead.
back
We
in
want to
if I
hear it
need to
all.
be.
Please.
SP6,
Okay.
I wear that every day. And when I started wearing that, I was having some hot flashes with sweats at night.
Mm,
I have those no more,
wonderful.
and didn't like maybe 2 months into wearing the SP6. I'm totally off my estrogen and progesterone. I have none of that.
And sleeping through the night, I
And
assume,
sleeping
right?
through the night.
Okay. Wow,
Mhm.
that's huge. I mean, when you're not sleeping, you're not healing. It's
Mhm.
miserable.
Mhm.
So you're sleeping through the night after 2 months on SP6, no more
Mhm.
night sweats.
Mm-mm.
The ice wave helped your back pain almost immediately. And was it upper, lower? What area did you
Lower back
lower back?
on
Did
the left side.
On the left side, okay.
Mhm.
Place the
Mhm.
patches down there. And
Mhm.
then you also start with X39 at first, X39 and Ice
I
Wave.
actually was wearing I because of my pain was so I had chronic pain. So
Mm,
I wore two X39s,
wow, yeah. Okay.
and that's what helped the most for me. And then I want to say maybe 6 months in that I was maybe more than that, 8 or whatever. But I'm down to one patch and would not have to wear it every day. But I know the benefits of wearing an X39 every day.
Yeah.
It's not just for that and the reverse aging. So I choose to wear it every day.
Well, and I know just since I've known you, your hair's grown in much thicker.
Yes.
Your skin is more vibrant for sure. Can you tell have you felt other benefits since you've been patching, maybe things that you didn't expect?
I know there's so many. And I said, I needed to write. I said, I need to know these things before I get on here tonight because there's so many different things. But I did want to say that about estrogen and progesterone, the hair, um, the night sweats with the SP6. Um, I will say this for the pain. Um, like if I've been with my knee, my bone on bone knee,
Mhm.
at night when I come in, or if I've just had a long day and I'm on my feet a lot, and let's just say you're achy. just achy from muscle, whatever,
Yep.
I apply my ice waves on the bottom of my feet.
Okay, great.
The white on the right, the tan on the left, and it relieves all my pain in my body
Okay,
within
so that
like
works
5 minutes, 5 to
great. So
10
that works
minutes.
systemically throughout your whole
Mm-hmm.
body if you place
Mm-hmm.
the patches, the ice wave patches on the bottoms of your feet.
Yes, and now that I'm speaking of the right and the left and the energy, I wear that and I get tremendous results from the energy enhancers.
I love energy enhancer
Mm-hmm.
patches.
And I wear them up here.
Okay,
Mm-hmm.
wonderful. Great. And I know you have a demanding job. You just have a demanding life. You're
Yeah.
always go, go, go. And so having clean energy is important, isn't it? Stimulant free and
Yes.
natural clean energy through the mitochondria. That's a beautiful thing.
Mm-hmm. Mm-hmm.
All right. Anything else you can think of that you would like to add to people? Anybody who's to someone who's never patched before, is there anything you would like to say or recommend or
I, I
mention?
would I would say, like I said, to be patient and to be consistent with them, and that I will say that they have been life changing for me. And
Wonderful.
I would just highly recommend, and don't feel like you have to wear, don't let it be overwhelming. Just maybe start with what we say is they said is the holy grail is the X39,
Yeah.
and the Eon. And if you do have pain, I would highly recommend the ice waves.
Wonderful. Okay. I
Mm-hmm.
know there are a
Mm-hmm.
lot of problems with
Mm-hmm.
pain meds. So
Mm-hmm. Mm-hmm.
Ice Wave is wonderful, clean pain relief. All right.
Mm-hmm.
Thank you
Mm-hmm.
so very much. We appreciate you sharing your
You're
experience with
welcome.
us. It does help other people. So, all right. Well, thank you, Melinda. We're
You're
going
welcome.
over to Miss Heather now. Heather, would you please, I guess you're unmuted. Can you
I
tell us about yourself and tell us your story, what your life was like before you started patching, how you discovered them, and
sure. I would
okay.
love to because it was my 50th year and it was a great year. As soon as I turned 50, I got shingles.
Oh,
I got COVID.
oh no.
I stopped having my period. So
Oh,
I would assume that's menopause. So triple whammy when I turned 50. When I did get COVID, I did lose my smell and taste. So that lasted about 2.5 years.
whoa. Two and a
And
half years. That's a long time.
it gets better. And a friend of mine sent me 5 days of patches. Now, this is 2.5 years in, and I said, of course, I'll try them for you. And I got them. I looked at the pamphlet and I put it on top of my dresser. So around that time, my skin started changing. So I started getting patches and they would turn into, big purple circles. And they kind of looked like ringworm, but it wasn't. I went to my dermatologist, had a biopsy, and it was granuloma annulare,
Okay.
and based off viruses in your body. So I went home and started researching different modality how I can treat this naturally holistically. And the biggest one that came back was phototherapy, light therapy, targeted light therapy. And for some reason, a light bulb went in my head and I said, where are those patches? I think it said phototherapy. So I went back home, I opened them up, read the pamphlet again, and I said, okay, now this is a year later. So this is 3.5 years. I'm going to do the patches. So I said, I'll give it 5 days. And about the third day in, my husband and I were going to the farmer's market. And I had in Ohio, when it gets a little bit nice, you have the windows down because you've been inside so long, it's so gray. So my window was cracked, and I'm starting to smell. And
Wow.
I'm like, honey, can you smell that? Can you smell that? I rolled the window down, stuck my head out the window like a dog. I'm literally smelling the creek water, the mud, the grass, the air. I was smelling. I immediately called Laura and I said, Laura, do these patches bring your smell back? And she went, "Oh, honey, they do so much." And I went, "Okay, bye." Hung up on her, went to the farmer's market like a little kid, apples, pumpkin pies, all of it. Went home that evening. We sat on the front porch and I listened to Dr. Stacy and a couple other videos. And the next day I called Laura. I said, "I'm in, sign me up." So
Yeah. And so those 5 patches she shared with you that was over a year ago before you
oh,
opened them.
yeah, it was probably 3.5 years now. Yeah.
But I
It's
mean,
all
they sat on where, your refrigerator, I think you
my
said?
bedroom on top of my on my dresser.
Okay, what patches were they? Were they X39?
X39. That's it.
And they sat there for over a year.
Over a year. And when you lose something like smell, you kind of forget. You just go on with life and you forget. But when that came back, that drive to the farmer's market, I had my body was I was energized. I mean, I couldn't I I love the smell of mud. I mean, I'm like, who likes to smell creek water, right? Um, it was fantastic. It was amazing. So I've been with LifeWave now for 2 years in August, and I've seen so many wonderful, wonderful results on so many people, and it's just getting better and better every day. And my skin's getting better. So it's a pesky little,
Wonderful.
yeah.
Wow, that's great. So have you used any other patches besides X39 over
I
the
use
past?
them all.
You use them all? Okay.
I use them all, and I'll be honest with you, I'm learning more and more about, the acupuncture points of the body and all of that. And I can honestly say, if you take the time and place the patches differently on your body, um, you do get different results. Some days I have higher smells. I mean, I smell it's instant. Some days it's not. I mean, it's just wild what's happening on inside the body. It's amazing.
Wow. So what have you felt? Have you felt anything besides regaining your sense of smell? I mean, I'm sure there were some unexpected results. I think it sounds like it was probably all unexpected to you, but were there some other things that you felt since you've been patching over the last few years?
Well, energy. I'm
Yeah.
sleeping. I mean, obviously, I'm in full-blown menopause, and I feel fantastic.
Yeah, you don't seem it, that's for sure.
Yeah, healing. I mean, I had babies later in life, so I just kind of didn't think, I was even. I just totally missed the whole perimenopause part, I guess. Um, but more energy, more patience, less anxiety, better sleeping. And my husband, whether he wants to believe it or not, is his hair is turning darker. We laugh about it. But yeah, it's all around a fantastic tool.
Okay, wonderful. So yeah, there have been studies done on, well, lots of studies on all of the patches, but on X39, one of them shows better brain coherence, that left brain, right brain balancing. It sounds like you've experienced a lot of the benefits. And that is one thing that really caught me off guard and surprised me, how many people I've met that said, my gosh, I was all gray and now my hair's growing back in that my normal old color, but not just at the roots. I hear it that it's all over. It's changing color. So that's neat, comes in fuller. But just to be able to have energy again, to be able to sleep more deeply, to not have those symptoms you had, to be able to smell. I can't imagine not being able to smell for that length of time. You probably just kind of forgot, you got used to it,
You
and
do.
when you could smell
It's
again, yeah, wow.
yeah.
Well, and we attribute so much to our sense of smell. I mean, that's why you can smell a perfume your grandmother used to wear, or type of a cookie or a bread she used to bake, and it instantly takes you back.
Yes.
So it's important. Wow, that's wonderful. And you say you've used all the patches. Can you tell people about some of those patches that you've used and why some of the others besides X39? That is our flagship patch, our foundational patch.
I'm using the X49 also. Every day. The glutathione is one of my favorites. I like to play around where I put that patch for the antioxidant, that part of it. Energy enhancers, again, like Melinda said,
Yeah.
just a beautiful, clean energy, and it just lasts all day. Um, and I also like to kind of think that it's making the communication better. Like it's just
Hmm.
talking to each other. Um,
Yeah.
I've used Ice Wave on my mom and my
For pain.
friend, just for pain.
Yeah.
Um, and it's an amazing, and that again is another amazing thing to witness is playing around with those little pain ice waves and actually seeing it go away. I
Yeah.
mean, actually seeing the pain go away. So again, it's not going to be instant, and it's going to take some time and research and patience. But take the time and patience and do it, because you will reap the benefits.
Well, and without the side effects, without the toxic overload that so many people are dealing with from medications now. That's great. What about so you've used patches on your mother, anything other than Ice Wave on her?
Yes, she is on X39 and glutathione and Eon. She had knee surgery, which I had her on all of those. She ended up getting a funky thing in her eye, and we've had some issues with her eye over the past year. So I've been adamant about her, wearing the patch, and she is now healing. So, and her friend has more energy. He's golfing, his pain. He had tendonitis in his ears, so we kind of played around with that, and it went away.
Well,
So again, it's an amazing tool. I think the hardest part for a lot of people is, it takes some time and research to try to do things the healthy way. You know, it's so easy just to pop something or take something, but take the time and dive in and research, because it's worth it. It really is.
yeah, it sure is. Wow. So you are now 53, correct?
I am going to be 55 next month.
50. Okay, so you're 54.
Yes.
How do you feel at 54 compared to when you were 50, when all this happened?
I feel fantastic. I feel
You
great.
feel younger now at age
Yes,
54 than when
I
you
do.
were 50.
Oh, 50 hit me hard because
Sure did.
mentally, I was always in shape. I had kids later, but obviously that there was a period of time there that you just kind of let things go, and it kind of gets crazy, and then you get hit with all of this stuff, and everybody just says, "Oh, it's midlife." I mean, the commercials say when you turn 50, get the shingles, get it, you have to get it. And it's like, dang, no, I'm okay. It was right. I turned 50,
Yeah.
had all this stuff happen. So, um, you know, I feel fantastic today.
Well,
So
you look fantastic.
thank you.
Yeah. So thank you so much for sharing this with us. I appreciate that very much. Leah, would you like to add anything, or would you like to jump in on the technology and further explain what Melinda and Heather were telling us about?
I would love to do that. This is the fun part of what we get to do is talk about how simply, you guys, this patch technology works. So now when you think of a patch, you probably think of, like these ladies were talking about, a pain patch or an estrogen patch or a nicotine patch, where there's something on the patch that's going to transfer through the skin and get into the blood. That's a transdermal patch, okay? That's not what LifeWave is. This patch is non-transdermal, meaning there is nothing on this patch. On the back side, it's sticky. If I can get it up there. Sticky on one side, smooth on the other. There's a white piece of fabric that's sandwiched between two polymer shells. Now, what is embedded in that little white piece of fabric, the owner, the inventor, the visionary behind this technology, it's a 20-year-old company. It's called LifeWave. And David Schmidt is that guy for us. He is the visionary in inventing this life-changing technology. So you guys, here's what David has invented. In that little white piece of fabric in the center, David has created a solution of compound organic amino acids, sugar crystals, oxygen. Now, it's a molecular structure. It's not the things that we find in the kitchen cabinet. This molecular structure is embedded inside that little piece of fabric, and it crystallizes into a very specific crystal structure that's now reflective. So here's what happens when we put it on our body. Our bodies emit a low-level infrared light or heat. If you feel your chest, you feel hot, that heat is actually a low-level infrared light. There's a very specific wavelength of our body's low-level infrared light reflects a signal off this patch back into the body, starting a chain reaction of cells to start communicating again. Exactly what Heather was talking about when she put that patch on. She could feel that clean energy. It's that the cells starting to wake up. So here's what it's doing specifically. It's actually elevating a copper peptide that our body makes called GHK-Cu copper peptide. Now, this copper peptide was discovered by this Dr. Lauren Picard 53 years ago in the human body. Now, you guys, GHK-Cu, he has over 5,000 studies on all the incredible benefits GHK copper peptide does for our bodies. Here's what happens as we age, that aging process that no one told us about, Heather. We just know those symptoms, right? The aging process is the fact that we lose our GHK-Cu copper peptide production as we age. Well, one of the things that we know, in addition to the neurological benefits, the vascular benefits of GHK-Cu, you guys, GHK copper peptides control our body's master regenerative cells. Now, if you don't know a lot about those, we start out that way. The egg and the sperm come together, make a cell. From that cell, they're duplicated, replicated, split, the body's formed. So we know those cells to be pluripotent, those regenerative cells, meaning they have the ability to morph into any cell, any tissue, any organ our body needs to be repaired. But remember, I said we lose our GHK-Cu as we age? You guys, age 35 was middle-aged because 50% of our master cells are dormant in our body for different reasons, right? We all know we all live different lifestyles. Some may suffer with injuries. We all eat different things, different environments, right? Those are why our cells stop communicating with each other. Now, by age 60, 65, which a lot of us are pushing or are already there, you guys, there's only about 8 to 10% of your regenerative cells in your body trying to heal and repair it. So this is what we do. We put this patch on in the morning. We go about our day. Now, remember, it's non-transdermal. There's nothing going into the body. It is using your light to signal your body to do what it was designed to do, and that's to heal and repair itself. And then we take it off at night. We say 12 on, 12 off. We want to give that body that 12 hours off for that reproduction and regenerative process to happen. Dr. Jennifer was talking about how important sleep is. You guys, that's repair and regeneration time. And if you're not getting a good night's sleep, your body does not have the ability to repair and regenerate. And then we put a new one on the next day. And we do that day after day, week after week. And what we see, and Dr. Jennifer mentioned our clinical studies, we have over 80 clinical studies, and they're not just clinical studies done by LifeWave. They are clinical studies done by doctors and third-party institutions around the world. This company is open for business in over 80 countries in the world. So these are double-blind, placebo published studies. You guys, we want you to research it. That was one of the things that was so important for Heather, is research. We want you to research. We want you to look at the 20-year patent David holds on this technology, on this one patch alone. You know, the clinical studies are huge in everything that we do while we are sharing this technology. You know, I know you heard some people mention some different patches tonight. I want you to get back with the person that invited you. Make sure they send you a copy of our health tracker. That's where you can track your progress, because you're going to want to keep a health journal, because we know you're going to end up on one of these podcasts with us. We want them to send you the patch summary so you can read what each system is supported by the different patches that we offer in our product line. And you know, of course, the X39, you guys, that's the starting point for everyone. This is the one that is going to give your body the ability to heal and repair itself. And keep in mind, this is a regenerative process. This is not a quick fix. This is not an overnight. Your body did not get the way it was in 30 days, 60 days, 90 days. It's an accumulation of years. So give your body the grace and the time that you need for it to heal and repair itself. I told someone today, don't stop before you get your miracle, because we know that this technology is scientifically, clinically patented proven. We know that it works. We can guarantee you that it works. We just can't tell you how long it will take your body to heal and repair itself, but we know that it will. We do know that. So drink your water while you're using this technology. That's going to be really important to stay hydrated as we use this. Our cells need that conductivity to communicate. They're little current, they're little electrical beings inside of us, and they need that to communicate. So 12 on, 12 off. How long do you need to do it? We say try 1 month for every decade you are old as your starting point. When you reach that point, if you want to stop patching, yes, stop patching. All of your health benefits are going to stay with you. You will start aging again. Now, I don't know about you, Dr. Jennifer, but I feel like in today's time, the aging process is going to be happening a lot quicker than it was when we were younger 30 years ago.
That's
So
right.
with that, I'm going to throw it back over to you and let you close us out. We definitely want you to get back to the person that invited you. Make sure they get you the information you need to get your questions answered and get your patches ordered with one of our wholesale packs and get started on it.
That's right. Thank you so much, Leah. And thank you all for joining us this evening. That was a great explanation of this technology. And if you'd like to do some more research, I'm not sure if we mentioned the website startx39now.com. Leah mentioned all the clinical studies on there, double-blind placebo, published gold standard studies. You'll find those on there. You'll find more testimonials. You'll find some great presentations, some great videos. And like Leah said, get back with the person who invited you here. Thank them for doing that, and they can help guide you on what which patches will be right for you. You can't go wrong with X39. So thank you all again so much. Heather and Melinda, thank you for sharing your stories with us this evening. And you all have a good evening and a great holiday. Thanks so much. Bye.
Thanks,
Bye.
everyone.